that thank you all for being here. I see so many of you that are always on our calls. Waves of Wellness is our WoW call that Tracy has so brilliantly put together in order to help us to help you. In other words, it's helping you to have healthy habits so that we can add more life to your years, not just years to your life. Remember that. You can add years, but if you're not living, it's not really living, right? You're just surviving. You're getting by. And our goal here and our commitment at QHS is to help all of our QHS family to be able to live healthier and understand why we tell you to do certain things or why we've learned that certain things are healthy and certain things are not. So I'm honored today that Kelly agreed to be my guest. I'm going to interview her. So it's a little different protocol today because Tracy is taking a few family days off, which is well deserved. All of you know how hard she works for all of us. And so she's taking a few days off. So we're going to be doing the show today. And then on Monday again on WoW Can Cook without Tracy. So we'll have some different protocols here that we're going to have to do. But thank you all for joining us. And of course, our wonderful, brilliant registered nurse, that's much more than a nurse. She should have been a Dr. Kelly, who's on our QHS team, on our admin team, is graciously going to be our conductor today. So she will help start the meditation. She will do the meditation at the end. She'll give you the preview in the beginning, and then I'm going to interview her to tell you what we know medically are the interactions of certain foods with certain medications. And I chose that subject for a very specific reason because I've had patients who almost died from reactions in the hospital and in nursing homes when medication was given to them. And Kelly's shaking her head because she knows she's been in all of this. And they were given certain foods that they shouldn't have. And it's very, very frightening. So we intend to help you to be able to take control of your own life by understanding what some of the contraindications can be and ask questions so that you're comfortable saying, well, wait a minute, is this okay with this medication? At least to plant the seed so that whoever is the healthcare professional helping you, if they don't know or the shift just changed and that nurse didn't know that they gave you a medication on the other shift that you shouldn't be having something and you have it, that's exactly what happened to my patient. So that's how this came up. It's not medical advice. We don't give medical advice or diagnose, treat, or cure. That's our disclaimer that's very important. But what we're doing is sharing the information and all the years of experience that Kelly has as a registered nurse, and much more than just a registered nurse. Like I said, she could be a doctor. She knows more than most doctors I've worked with. So as soon as we do the preview for the week, we will start, and I'm going to start quizzing Kelly. So go ahead, honey, do the preview for us.
Okay, so this is going to be the sneak peek for the upcoming week. And just want to make sure I have all the sound.
That's okay. It's brilliantly done. Tracy's done a fabulous job with these. I call it my new version of a TV guide for any of you that remember TV guides.
So hopefully the sound comes through on these because I was having problems with the sound. So hopefully this will be our little test run on that. So guys, let me know at the end how this sounds.
Okay.
Welcome to the QHS Sneak Peek.
It's fine.
A week of growth, sharing joyful moments, learning and developing the new you, both masterful and wise. Monday on WoW You Can Cook, we feature green shakshuka, which is a perfect summer breakfast. Healthy, simple, delicious, and anti-inflammatory. Wow! Monday and Thursday on Vibe Tribe, we are standing strong in our belief that true wellness develops from the inside out, and that approach is setting a new standard of well-being throughout the world. When we have the courage to stand up for ourselves and others, we inspire those around us to do the same. Tuesday on Key, elevate your mood. Achieve the perfect balance of action and knowledge to create change in your everyday experience. Learn to see the patterns in your daily life and how to use them to make being happy easy and constant. Tuesday's Pray For Me is a massive step into the God Spark action mode. Pray For Me is where members share dynamic, committed, prayerful action for themselves, other members, and their loved ones during a heartfelt live Zoom call. Request prayers online at quantumhealingsystems.org/prayer chain. QHS is working on a quantum level multidimensionally in every way. On Wednesday is the wonderful volunteer call with Inside Scoop for active members seeking to take a role in QHS projects. If you're interested in all things QHS and want to help, this call is for you. Thursday on WoW, Darlene will share the benefits of sweating, which is so good for detoxifying your body, creating healthy habits for lasting lifestyle changes. Breathe on Friday. This class is transformational, practicing breath with intention. WoW Can Breathe is giving you the ability to release trauma to transform your life. We close the week with the fabulous Q&A call. This is the members sharing their experiences, bringing their questions to the team for answers. This is all about the global focus of QHS, where we've been and where we're going. It's the time capsule to every week. Our amazing admin team loves seeing your smiling faces on live Zoom calls and hearing your incredible testimonials. Check the newsletter for complete details of each event. You can find all the links to join each call on the website's community resources page. And while you are there, check out the BioScan project. Make it a beautiful week, my friends.
Great. So I call that my weekly TV guide or TV digest. Can you? I'm getting echoes. I don't know. Are we okay?
It went on to the next video for whatever reason. So I apologize.
So we're okay now? Okay.
Yeah.
Cheryl, did you have a comment before I get started?
Yes, I just wanted to comment, at least on my end, the volume was super low. I heard it pretty clearly, but if there's any way for you to modulate it up, that would be great.
Yes, I agree. Thank you, Cheryl. It was very low, and I don't know why, but you could all hear it, right?
Yes, but it was just super low.
Yeah, it was. It was.
That I've changed all of the settings.
Well, we could hear it. It was just really low. You really had to pay attention, right, Cheryl?
I know.
Yeah, you had to pay attention.
Maybe try to up your own on your own computer. See if that would help.
Do what on my computer?
Turn the volume up on each one of our own computers to see if that would help.
The only
I
other
did
thing
that. Didn't help
Steph,
much.
is there something that you have, Steph?
Yeah, I would say don't worry about it right now. That's just keep
I could hear it perfect.
everything else is loud and clear.
Yeah, it was just low. Okay, well, anyway, when we have these, let's see, do we have anybody that has never attended a WoW, Waves of Wellness call? Raise your hand like this if you haven't attended any. Everybody has, okay. Again, we are hosting. You can't put your hand up. Okay, Danielle, thank you. It's okay.
Oh, you can see me now. I couldn't see
I can see you. I can see you.
Oh my
That's
gosh.
okay. Thanks so much. Thank you.
Yeah.
Thank you.
Wow.
The important thing is that Tracy was able to take a few days off, which she needs and she deserves. It's well overdue. And as I said in the introduction, very briefly beforehand, before our preview of the week, is that there's so many contraindications that are happening. And, I'm still in practice. I still have a full load of patients that I do remotely. And it's very frightening when you are talking to people, they're in the hospital, their spouse is calling you in a total panic saying, she's having an allergic reaction. She can't swallow. She's got welts all over her body. What do we do? And then you have to start playing detective. But as a non-medical, I am a naturopath, a homeopath with specialties in inflammation, fibromyalgia, chemical sensitivities, mold, but I'm not a medical doctor. I cannot call the hospital and say something. So our main goal that we put together, Kelly and I, was to educate you so that you can learn to be comfortable to ask questions and don't just take somebody's word for it. Don't just take a pill. I have patients that I'll say, what did they give you? I don't know. They just told me to take it for high blood pressure. What do you mean you don't know? Did you even bother to ask? Are there any contraindications? Did you go online and see what the side effects are? People of our generation, my generation, were not used to asking questions. My mother and grandmother would have just had a fit if I would have suggested they ask their doctor a question. He's the doctor. You know, he's God, he's the doctor. But it's not their fault. They're not taught nutrition in school. It's up to us. It's not up to the doctor. It's our responsibility to learn as much as we can and to be comfortable with asking questions about our own health. So that's why I asked and Kelly if she would put together some hints for us. But I'm going to give you a couple of examples afterwards, and I'll interject. So Kelly, how would you like to start? I have a big bugaboo with grapefruit. So you don't have to start in the order that you had your notes, but I want you to start with some of the things that I didn't even know that you put in your notes that you sent me. Are we going to make that available to our participants? Yeah. Okay. Yeah. So she did a beautiful PowerPoint, so you don't have to take a bunch of notes. She's got it all in bullet points in a PowerPoint, and we'll make that available to you. That way you can just concentrate on what Kelly is sharing with us. So Kelly, start out with what you know. You had some food interactions that I really wasn't aware of. So I learned a lot from it too. Start out with very briefly, give us a quick overview, because you're not just an RN, dear heart. What is your specialty, and what experience have you had for those people that maybe haven't heard that?
Well, you know, I've been in the healthcare field since I was in high school. I started out working in doctor's offices and, you know, front desk reception, and I sort of worked my way up the chain as a medical secretary. And, you know, I worked in the administrative side for a long time, and then I went back to school and I got my nursing license, and I worked in regular medical, surgical, adult, cardiac, telemetry, renal oncology, bariatric services, hospice services. I mean, I've done a lot. I've worked with assisted living, palliative care. I have a very broad range of nursing. I worked in recovery room for postoperative. That was probably my longest job. But again, you have to know sort of everything: critical care, emergency medicine, bedside skills, you know, because in the recovery room, you don't necessarily have a doctor there with you. You have to know, when you're looking at somebody's medication list, what you can and can't give them to eat after their procedure. And it's not just related to the procedure, it's related to their entire medication list. So you have to be aware of drug interactions with different foods, so that you don't inadvertently give somebody a tray of food that they can't have. Because, you know, when you're in the recovery room, it's very separate from when they're on like a nursing unit and their diet has been approved by the doctor, by the nutritionist, by the person working in food services. You just get random food up in your cafeteria or to hand to people. And if you don't know that there's an interaction with a specific food or drink to something that they're on, you're on the hook, because there was no check and balance. You just had to know that information. So
you as the nurse would be on the hook because you were in the recovery. I see. Yeah. Okay.
Yeah. So it's not like you have an order to give a specific food to somebody, you know, because that's their diet. It's post-operative. You're just supposed to know. So if you didn't know that information, you needed to get yourself on track real quick with knowing the most basic, and there's a lot of them, food interactions with medications. And you know, and it can be really tricky, because even extremely healthy foods can be deadly to you if you're on a specific medication. And I'll go into more of that and it may not even be an immediate reaction. Right. It could be a delayed reaction that happens because they had that specific food. And then it could be days later and they can't correlate that with something else. And they're like, I don't know what happened, you know,
but it was because, exactly,
you know, so it's really important to know these things.
So if I can interject for a moment, I mentioned to you that I have a real thing with grapefruit. I love grapefruit juice. I have fresh grapefruit juice, you know, totally unsweetened, just fresh whenever I can, especially being in Texas. I mean, we've got amazing grapefruits. But the one case that prompted me to put together something with Kelly in order to help you to understand the importance is a patient of mine had a stroke, a woman in her late 50s. And she goes into the emergency room, and a long series of things happened. All the tests were done and all that. And then they kept her overnight. Well, overnight, the shift changed and they put her on anticoagulant medications. So blood thinners, basically, Coumadin, which is what I was on after my accident. And then the nurse comes in and brings her a big glass of grapefruit juice. And she starts having anaphylactic reactions. She had welts that were this big, size of an egg, all over her, from her chest up to the top of her head. Her husband comes in and freaks out, doesn't know what's going on. And they had to wait hours before they could call the doctor that was supposed to be on call that day. And then they gave her a Benadryl. I mean, that could have been life-threatening because she just had a stroke. And the doctor wasn't happy when he came in, and rightly so. But it was that shift of nurses that I'm sure, Kelly, you've seen, that was where things fell between the cracks. So when I talked to her afterwards, and she's doing fine, I've been helping her since she got out, and she said, "I'm so happy that you said something to me afterwards." I spent an hour and a half with her and her husband on the phone. I said, "These are the things that you have to ask. You don't just take them." She never goes to the hospital. She's very alternative. She's great about her nutrition. She walks 10 miles a day. I mean, this woman is really healthy. What we found out was that she has a hereditary disease called, is it Gato? No, I got it wrong. It's that hereditary disease where the blood vessels shrink. I can't think, it's a duplicate word. I'll think of it in a minute. And I had to do research on it because I didn't know what it was. And so the blood thinner they gave her also was too much for her weight and her age. So they didn't even test anything beforehand. So that's what prompted me to talk to Kelly. And I said, I have a big thing with grapefruit because I have people on cholesterol medication and they're eating grapefruit and they're having tons of citrus every day and nobody's telling them. So one more thing, and then I'm going to give the floor back to Kelly, is that when you get a medication, there's warnings on them. But most people don't read them. Like, take them with food. Don't take them with grapefruit. The pharmacist knows better than most people what you should take and what you shouldn't with certain medications, or what you should eat. But a lot of people, including my patients, don't read. If most of my patients aren't on medication anymore, but those that are don't seem to read it. They think, oh, well, this is, my blood pressure medication is being renewed, and they don't even read the disclaimer on it. They don't read the warnings. So this is where you have to take charge, because all of the things that she's going to talk to you about are listed in the PowerPoint so that you can refer to it later. So go ahead, Kelly. Go take it from there.
Okay, so before I get to the whole grapefruit issue, let me explain some of the things that are the reasons why foods will interact with medications, because it's not necessarily just a food drug interaction. It's what's happening on the inside of your body, on the biochemical side of it, as that medication breaks down and what it's interacting with in your system and what's happening. So some medications, when you eat them with certain foods or drinks, can increase the absorption of that medication or prevent the breakdown of that medication in your bloodstream, which would cause that medication to build up in your bloodstream. And that does two things. It means that you're probably getting way more of it than is intended for you, for your body weight and for your size and for your problem. And so we call that supra or over medicated, right? And so if it in the case of the blood thinner, then you can bleed out, right? Because your blood is too thin, right? And if it's the case of you can't break it down, then any side effects that are known with that particular medication are going to be that much more prevalent in you. So for example, if you're taking a statin medication, one of the major complaints of the statin is that people get leg cramps. So if it's building up in your system, your leg cramps could like be over the top because there's so much in your system above what we thought it was going to be based on that dosage that you got.
Now tell our family what statins are used for those people that may hear it but don't know what it's used for.
Statins are used to lower your cholesterol in your bloodstream. Okay. or it can decrease the absorption and or accelerate the breakdown. So it would have the opposite effect then, where you don't have enough of the medication in your bloodstream to achieve the therapeutic effect that it was designed for, because you're either excreting it too quickly, or you're breaking it down too fast. Okay. And so that's not wanted either, because what's the point of taking a blood thinner to thin your blood and keep you from having blood clots if it's not doing the job it's supposed to do, and then you develop clots and then you die because you had a major heart attack or something. So that's not wanted either. Also, during the different physiological reactions that it can cause during the assimilation and use of the drug, it can cause damage to other bodily organs as an unintended side effect. So it's really important to know what foods and medications that you can and can't mix to avoid that stuff from happening. And one of the only ways to know that is to read those printouts that come from the pharmacy, or to ask the pharmacist, or to ask the nurse who's about to give you that medication if you're actually in the hospital, and say, can you tell me if there's any food interactions or photosensitivity that might happen with this? Like, what do I need to know? Because I will guarantee you that the nurse probably does not know. They are so overwhelmed with the job that they are doing. They turn into robots, and it's like, okay, here, take your medicine, take your medicine, take your medicine, because they have 12 patients and each person is on 40 or 50 medications. They finished one round of medications and they got to start all over back at the other side. And so like, you just become like, it's rote, but you don't necessarily take that time to be like, I wonder, I haven't looked at this medication in a long time, or it's a new medication and I just don't know enough about it. So always ask, because oftentimes if they're using any kind of a computerized system, there's a little button that they can push that will say common interactions or common side effects. And if you just ask the question, they'll take that extra 30 seconds and look and tell you, oh, well, wait, you have this in your diet. You shouldn't be getting that, you know? And it's a good from the patient perspective to the person giving the medication. What else? Oh, so also things that can affect it is how quickly the contents of your stomach empty into your intestines. If you take certain medications with things like iron or zinc, other things like that, it can cause chelation, which will affect that. Certain things take it, like, okay, if you were to take alcohol with certain medications, it potentiates the central nervous system depression that you get from alcohol. It can intensify it that much more. So like, you should never mix like narcotics and alcohol, or like a Valium and alcohol, things like that. And you would think that that would be common knowledge and common sense to certain people, but common sense isn't all that common, you know. So people, if you don't specify that for people, they'll do that and then, you know, pass out and have problems. The amount of gastric acid in your stomach will also affect how your drugs break down in your system. It has to be the proper acidity, because if it's not acidic enough, it may not break down the drug the proper way, and then that can cause problems in your intestine. And if it's too acidic, it may break down too fast. So if it's an enteric coated drug, you may be getting the wrong medication at the wrong time for the proper absorption. Also, if you have a very high fiber diet, can also affect the ability to absorb the foods, because again, it may be preventing the food from getting to the right section of your intestine to break down in the right place to absorb properly. And also the amount of bile that your body secretes can affect it. For the same reason.
And to add to that, it's when a prescription medication, remember, we're talking prescription medications here. When a prescription says take on an empty stomach, you know, half an hour before a meal, or take with food, it means it, but people don't pay attention. And again, I have found that when I have questions about things that I don't know, I mean, there's no way I know everything, I call the pharmacist. I'm very fortunate to have a nurse practitioner that's a genius, and she was an RN like Kelly, just about the same type of background, and she became a nurse practitioner, and I can call her anytime, and she's got her little gadget. You know, it's like a cell phone, but it's a separate, I don't know what you call it, Kelly. And she just says, hold on, let me look it up. And she can even, you know, whiz it off at the top of her head, because she's got it on the little device that comes up instantly. So you just have to learn to ask questions, and don't ever feel that you are belittling, or that you're being impolite, or when you're asking those questions. It's your right, it's your body. Nobody has the right to give you something without answering a question that you have about why you're taking it and how you should take it. And if you do have questions, it's always much easier to call a pharmacist. Do you agree, Kelly? It's hard to get a hold of the doctor, and most of the nurses are so overworked, like you were saying, that they may not know. But if you call the pharmacist, that's their job. That's what they've studied. That's what they know. And I've never had a pharmacist that tells me I don't know. And so,
and to your point, Gloria, there have been times when I was working in the hospitals that I wasn't absolutely sure about something, and the fastest way to get an answer was to call the pharmacy in the hospital and say, hey, can I talk to the pharmacist? And sometimes they needed to look it up themselves because it was ambiguous, on their side, whether something could be mixed together or not. So they really are the best ones, because in their computer systems too, systems are built is to cross-reference like multiple things that you're on and different medications and drug and foods that you're on for interferences and stuff. So they're really the best ones. The doctor is not the one to ask, because they just write the order. They don't necessarily know if there's an interaction. That's not their ball game. We need to be really careful about what people's specialties are, right? If you're talking to a cardiologist, they may know the cardiac meds, but don't ask them about something that's for your liver, or something that's for your gout, or something that's for your, for your heart, for your kidneys or something. They may not know the answer because they are so myopic to their own specialty. And even with that, they're so used to just writing the prescriptions, they'll be like, oh, just ask the pharmacist. Because even as much information as they get in medical school about prescribing, it's not as intensive as the drug, the pharmacists get. So they really are the go-to person.
Well, and then new drugs are developed all the time. So they're not, it's not their job to be able to sit there and give you nutritional advice, or to sit there and dissect what the medication is. Their job is to know what to give you that would help alleviate the condition. And if you want to know more, you better do your own homework. This is why research is so important. People will say, well, I didn't know that. Did you ever look it up? Well, no, I don't know how to look it up. What is the counteraction? What's any contraindications to metformin, for instance? One of the biggest ones, and that's for diabetes, is make sure you take it with food, because you can get a horrible stomach ache. I've done it, I know. And you can get a horrible stomach ache from metformin if you take it on an empty stomach. So, hopefully this is helping you to understand the doctors are not God. They're human beings. They have their specialties. They know what they're doing in their area of expertise, but don't expect them to be a nutritionist and to know all of these answers, because it's not they don't even have time. They don't get paid for the time that they're running people through.
They get 1 hour of nutrition lecture in their entire 4 years of medical school. 1 hour.
Yeah. The critical care internist that saved my life told me that he got 8 hours. I used to send patients to him, and he'd send patients to me. And never did I know that he'd have to end up saving my life, because he was critical care at Deaconess Medical Center. But he said, Gloria, you've got to go work with these people on their nutrition and on their supplementation, because he said, I had 8 hours, and he was a critical care with, so many other degrees behind his name. So Kelly, I really want you to focus so that we don't run out of time and we can take questions, because I'm sure we're going to have questions. I really want you to focus on the common drugs and what foods you need to avoid. Like I said, grapefruit is my biggie. So start with whatever you feel comfortable with, but let's talk to them about what drugs, and let's talk about the drug, but what it's used for. Like, for instance, when you Lipitor, tell them what category, or like I just mentioned, so that they know what it's for.
Right. Okay. So we'll go back to the grapefruit, because that is probably the most common food interaction that covers the most drugs that people can be taking. Okay. Now, the reason that grapefruit itself is the problem is because there's an enzyme that gets blocked for metabolizing of the drugs in your intestines when you drink or eat grapefruit. And not just grapefruit, it can happen with like any type of bitter citrus. So like bitter oranges, blood oranges, Even it can actually technically even happen with lemons and oranges, but not so much of the really super sweet ones, but you still should be
Right.
aware of it in case there's any issues. So that's what's happening, is it's not allowing the breakdown. So then the drug builds up in your system. So it's that first scenario where you could have way too much in your system. So that patient that you were talking about, Gloria, where she had those problems, what you were describing actually sounded more to me like a real allergic reaction to it. Whereas what I would have expected, if there was an interaction with what she ate with the grapefruit, would have been a potentiation of the blood thinner. So for her to be overly
Over-medicated, yeah.
overly coagulated to the point where she was at risk of bleeding.
Right.
But you can have different side effects in different ways. So that could have been the same thing.
What
But
it was.
blood pressure medications, and there's several different classes. The most common class that it could happen is calcium channel blockers. So, and you would know if you were on a calcium channel blocker, but that's probably the biggest culprit.
And she's got them listed. They're in the PowerPoint with some of the typical names, not all of them. So you'll have that as a reference.
Yeah, and I'd rather do it that way because there's lots of drugs within the same class. There's thousands of blood pressure medications, and they may fall into that class. I don't want to give you one example and then have you say, "Oh, I'm okay." Right. So you're better off saying, "Oh, is this something that I'm on?" Antiplatelets, so things like Brilinta, aspirin, antiplatelet aggregators, things like that, things that they work to make your red blood cells slippery. Similar to aspirin. Aspirin works in a couple of different ways, but this is similar to aspirin in that it makes your red blood cells kind of slide against each other. So if you had blood that was a little thicker, it would be less likely to clump and stick together. That's how those type of medications work, which is slightly different than an anticoagulant, which works on several of the cascade processes, whereas how your blood keeps from sticking. It doesn't work on your fibrinogen. It works basically just to keep them from attaching. Antiarrhythmics. So that's anything like amiodarone, lidocaine, some forms of dopamine, anything that's classified to keep your heart in a proper rhythm. Digoxin, that's another big one. Any of those kinds. So if you had a problem where your heart was irregular and you got put on one of these medications, you should not be drinking grapefruit juice or eating grapefruit. Cholesterol medications like statins, like I said before, Lipitor, Zocor, Crestor, those type of ones. And the reason that happens is it prevents the body from how the statins work is it takes the cholesterol that's floating around in your system and it uses it. It takes that out, and instead of using the cholesterol to patch the lining of your blood vessels, it pulls the circulating calcium, and it uses the calcium instead to patch up those little tiny breaks in the lining of your vessels. So that's how you get atherosclerosis. And research has actually shown that people who take statins are actually at a higher increased rate of myocardial infarction or heart attack than people who don't take them. So if you are on one, you might want to do some research and look at that. I'm not going to give you any advice, but I'm just going to tell you what the research shows. And it is still something that's listed as a marker that the doctors have to order if you've had a cardiac event or cardiac problems to meet their standard of care, or they get dinged and they could lose their license. And it's amazing because the research does not back it up and they still haven't taken it off. Makes you wonder what the underlying reason is behind
exactly.
Story.
And one thing that really surprised me that I didn't know, Kelly, when you put it on your list is antidepressants. I mean, they're so widely prescribed now, and I never thought of grapefruit juice with my patients that were on antidepressants. I have to proudly say that 95% of my patients are off antidepressants, but there's still a lot of them that are on it, and I never would have thought of grapefruit juice. So what does that do to the antidepressant? Does it make it more effective or less effective? Does it accumulate more?
So it can cause a problem called serotonin syndrome, where,
Uh-huh.
so this happens especially with SSRIs, which are called selective serotonin reuptake inhibitors. It's just a really fancy word for saying that it blocks the ability of serotonin to connect to the receptors in your brain. And so that creates a feeling of euphoria. So it's used for people who have depression to make them happier. But what happens is if you have too much of this blockade going on, the serotonin builds up and builds up and builds up, and then it spills out into your system, and it can cause a lot of medical emergencies. You have over agitation, restlessness, rapid heartbeat, high blood pressure,
anger,
yeah, agitation, like, you know,
Yep.
it's a problem, and you can really have a lot of physiological problems because of that too, which is one of the reasons that when somebody stops an SSRI, they can't just stop it cold turkey. They have to be weaned off of it because that sudden release into their you know, of not getting that, and all this serotonin that's been building up will suddenly then attach to those cells and cause this problem. So you can't just stop taking it abruptly. So that's one of the reasons. Anticonvulsants, seizure medications, for a very similar reason. It will build up in your system, and then you could have excess seizures, or what we call grand mal, or status epilepticus, where they can't stop the seizure easily.
right.
This is a big one. People don't understand when you take something like Robitussin, Mucinex,
Yep.
the big one, like some of these like over-the-counter Advils and sinus cold relief tablets and stuff. If they have dextromethorphan in them, which is the cough suppressant, and it's a cough suppressant and expectorant called dextromethorphan, that should not be taken with grapefruit juice either. And people will think, oh, I have a cold, I should drink grapefruit juice because of the vitamin C.
Vitamin C, right. But
That's
you know, it's
probably
not
the
just
biggest one. That's the
grapefruit. It
hidden
is
one that people
lemons.
don't- You know,
Yeah, it's lemons and limes too. Remember that.
Right,
Not in
right.
everybody, but you're correct. It can be any of the tart citrus. So when somebody is on those medications, I tell them no citrus, no lemon, lime, you know, any of that. Oranges, it doesn't have to be just a tart orange, an orange of any kind, or a grapefruit, because as long as it's citrus, it can have, not necessarily for everybody, but for most people, it can have a side effect. Yeah, go ahead. We've got
So that's
a bunch
big
of
one.
herbs and stuff to talk about.
That's an everyday one that people would never even think to put those two together, that would be a problem. So then you get into things like erectile dysfunction medications like Viagra, Cialis, those you shouldn't have grapefruit with, and suppressants. So if you've had an organ transplant, or if you have you know, the type of autoimmune disease where you're on an immunosuppressant medication, you should not be taking grapefruit in any way, shape, or form, because it can reverse the effects of that immunosuppressant, which you need to prevent you from getting a massive infection and causing organ infection. So that's a big one.
Right.
And some urinary tract medications. So like if for men who have benign prostatic hypertrophy or prostatic issues, they may be on a medication called Flomax or tamsulosin. And women can actually be on this medication too if they have issues with their bladder, but it's mostly men that are on this. Again, you should not be having grapefruit. Those are the biggest ones for grapefruit. And then the next class of medication that's a big problem is Coumadin. So this is an anticoagulant.
Yes.
It's the first generation blood thinner that was on the market. It's been out there for probably 200 years. You know, and there are still people on it today, but there are second and third generation anticoagulants that do not have this problem that I'm about to talk about, that are much safer. They don't need to have frequent blood drawers to make sure that the level is therapeutic. But there are some people that those medications are contraindicated in for certain reasons, or they never get to a therapeutic level to prevent blood clots and things like that. So they're forced to take this first generation form of anticoagulant called Coumadin, also known as warfarin. That's the chemical name. And with this,
well, can I give you my name for it? It's rat poison. That's what it is. I had to take it.
That's exactly what it is.
It's rat poison. You put it out for rats, and they bleed to death because it thins your blood. And I had to take that when I got the blood clots, and it went into pulmonary embolism. So I had 10 years of side effects from that Coumadin. It was awful until I
It's
could get on
problematic.
a natural blood thinner. Yes, very much so. My liver didn't like it. That's why it shut down. So go
This
ahead with the
page-
Coumadin. I see on your notes that the leafy greens are a big thing. And nobody
Yes.
told me that in 1993 or 92 when I had my accident.
And the reason is
Nope.
because when you're giving Coumadin to somebody, right, if they start to bleed out, or if you need to do surgery on them, or there's any kind of problem, the antidote we give them in the hospital is vitamin K, or aquamaphytin is the chemical name,
Right.
but K is the antidote to Coumadin. So any foods that have a high vitamin K concentration are going to do the opposite of that medication. So if you have somebody like me, for example, before I switched to carnivore, I used to eat leafy greens pretty much every day, and I would have approximately the same amount and the same, general, today I'd have, kale in my salad, tomorrow it might be spinach, the next day it might be broccoli shards or something, right? Or steamed broccoli. I was having a regular amount of these greens in my diet on a daily basis. If I were to have been put on Coumadin, I probably would have had no problem as long as I maintained that regularity. However, what will happen to people is that they are incessantly terrible at eating their green veggies, right? People don't want to eat their veggies. That's why it's such a big problem, right? So they go for a week or two without having any greens, and then suddenly sit down to a spinach salad, right? And now
Right.
suddenly they go and they get their INR taken, their blood drawer, and they're all messed up. They got to start all over with getting to the therapeutic level again. And in some people are very, very, very sensitive and cannot have any leafy greens if they're on Coumadin, because if they do,
Right.
they can never therapeutic level. They're just constantly with the blood up and down like this, and that's not good for your system either. And then the drug's not doing what it's supposed to be doing, whether it's too low or too high. And so those biggest ones are spinach, kale, chard, broccoli, cauliflower, and canola oil. How many things
Oh,
are
that's so bad anyway.
it's in everything. They put it in all these dressings and
It is.
sauces, and hidden, like they cooked in your food. You cooked your food in the canola oil, especially in restaurants, and anything processed, they use canola oil, right? So you have to be aware of that, because if you're on Coumadin and you can't get to a therapeutic level, and nobody's looking at what you're actually eating and buying at the store, that may be a hidden ingredient that is hampering your progress, so that's a big one.
Well, or they're listening to Wow, You Can Cook, and they know that in all the handouts and ebooks I've done, they know that all those vegetable oils are toxic. But as Kelly said, maybe you're using the coconut oil and the avocado oil to cook. Okay. But as she said, if you buy anything that's already made that you didn't make from scratch, which is why we're doing the dishes that we do on the cooking show, you're going to get the canola oil anyway, because it's the cheapest. When I was in North Idaho, the beautiful fields of canola, the bright yellow flowers, is what they had everywhere. And they're also sprayed with pesticides with the crop dusters every day. I mean, it's terrible. And so not only is it toxic, it's also heavily sprayed. So even if you're not cooking with the bad oils, you're getting them if you're not cooking everything from scratch. So,
Yeah.
And salad dressings are one of the worst. Yeah. Yeah. Go ahead, hon. I'm really anxious to hear the next one, because I have a comment about that. And I think that's where's the one that had the licorice?
Oh, the MAOIs. Okay, yeah. So this is a very common drug interaction with foods, but it's a medication that not very many people are on. So this is another form of antidepressant, and it's the drug class is called MAOI, which stands for monoamine oxidase inhibitor. It's just a really long way to say a drug that reduces oxygen of one amino acid in your body.
Right.
So they label it as MAOI. Now, you would know if you were on an MAOI, because there are so many things that you cannot eat that are common things. Your doctor would be like, you have to watch everything that you eat, everything that you take into your body, because it reacts with literally everything. But it is something you should be aware of, and it's interesting to discuss because of how many things that you can't eat with this. So yeast any kind of yeast, I don't care if it's nutritional yeast, if it's brewer's yeast, you know, anything like that. If it's got yeast in it in any way, shape, or form, you can't have it. Alcohol, beer, bread, especially sourdough bread, anything that ferments. You can't have soy fermented. You can't have pickles. You can't have kimchi. You can't have sauerkraut. Anything that's fermented, either through a yeast process or anything like that, anything aged, processed, you cannot eat. Chocolate, you can't have chocolate. You can't have yogurt. You can't have processed meats of any form. You can't have aged cheeses like aged cheddars, brie, blue cheese, anything like that, off the table. Organ meats, they have a very high amount of a chemical called tyramine. Tyramine is the amino acid that we're talking about. And it's in mostly protein foods, but it's also in some fruits and vegetables. And it blocks the ability of your body to regulate your blood pressure. So if this tyramine builds up in your system, you could go into a hypertensive crisis, which means that your blood pressure is so high that you cannot regulate your blood pressure, and you could die of heart attack, stroke, you know, so many different things. It's extremely important to know if you're on this medication, what you can and can't do. What's another thing?
Okay, so let me hit on that, on the cardiac aspect of it right now, since you just mentioned it. Something that she has on the PowerPoint that you will see is other foods to avoid. So let's skip to that for a minute, and let me if I may,
not long, and then we'll go right to your. Let me just finish these last couple things on this slide, and then.
Oh,
and then
okay.
we'll
You're okay. Sorry. Okay.
Another thing: legumes, peanuts, lentils, things like that. You can't have that. You can't have tofu. You can't have overripe fruit, especially bananas, mangoes, and avocados. Anything that ripens, you can't eat in the ripened state. You would have to eat it in the green state. And who the heck wants to do that? Citrus and tropical fruits. Any meat tenderizer. So if you went out to a restaurant and they used a meat tenderizer on your food, you cannot eat that. You'd need to let the person know. So basically any aged foods, processed foods, and the longer a food has been from the time that it was basically created or made or packaged, the longer out. So like say something expires on Friday. On Monday, you might be okay. The closer you get to Friday, the more tyramine is building up and the worse it is for you to eat. So you have to eat extremely fresh foods. So that's what it is with that one. And every drug, like if you ever look at the back of a medication bottle, not even just a regular medication bottle, but like an over-the-counter medication, it interacts with just about every over-the-counter medication, Tylenol even. You can't take anything. So you would know if you were on one of these medications, but it's interesting to see just how many foods it would interact with and how that would affect your life if you were on one of these medications. Okay, go ahead, Gloria.
Right. Okay, so she's got a nice list here on the PowerPoint on other foods to avoid. And she's got licorice. It can prevent the breakdown of medications in the blood, leading to over-medication and severe complications like digoxin, right? Okay, so I have a story to tell, because I had a lot of patients a while ago when I was in Idaho that were going to several acupuncturists. And I love acupuncture. But they were giving them a supplement that was licorice, because licorice is very good for stress and for your adrenals and all of that, okay? And you know that, obviously, Kelly. And but their hypertension kept getting worse. No matter what I did with their diet or what I did with homeopathics or with supplements, we couldn't control their blood pressure. And finally I said, what are you taking new? I mean, I take an inventory every time that we do a consultation. Have you taken anything new? Oh, no, not really. Just the stuff for my stress from my acupuncturist. What is it? Read the label to me. And it was licorice. Licorice, and I learned this when I studied in China, licorice raises blood pressure. So if you're taking a supplement for stress and it has licorice in it, I can't take it. And it has licorice and you're having blood pressure problems, get rid of the licorice. Because even if you make all the other changes in your diet and supplementation or herbs or whatever, and you're taking licorice, and I had acupuncturists actually argue with me about it. And then when I showed them what was happening, patients didn't have hypertension or they were right on the verge, and then they had it, they realized that there was a connection. So licorice is another one of my bugaboos because I've seen what it does to patients. So go ahead, mention some of the other foods real quick, and then we'll start taking some questions.
Okay, bananas and salt substitute. And the reason behind this, and it's not just bananas, I would say also like oranges, anything that has a very high potatoes, anything that has a high potassium concentration, okay, especially these salt substitutes. If you're on, say, a diuretic, you need to know what kind of diuretic you're on because it can cause really big problems. If you're on a diuretic that wastes potassium, so meaning it pushes out potassium with your urine when you pee out that excess fluid, then you need to replace that potassium. So you need to then eat things like bananas and take that new salt stuff that has the potassium in it, to take potassium pills. You need to replace that as you're urinating it out. But if you're on something like a thiazide diuretic that spares your potassium, so in other words, as it passes through your kidneys say, oh, that's sodium, that's potassium. We're going to keep those and we're just going to pass out the urine. Then that potassium will continue to build up in your system. And either situation, if you have too high or too low of potassium in your bloodstream, causes cardiac dysrhythmias and fatalities. It's a huge, and it's such a fine line to draw. The number for the normal range is so tightly managed that even just a tiny bit too high or a tiny bit too low, you are really in trouble. So you need to know what kind of a diuretic you're on and what you should be doing, if you should be taking excess potassium or limiting potassium containing foods in your diet. That's a big one.
Okay, and that's a big one. Yeah.
Caffeine is another one.
Okay.
We know caffeine is a stimulant, right? So we expect that to speed up our heart rate, increase our blood pressure. That can affect things like Ritalin. If people who are on ADHD medications like Ritalin, if you are going in for surgery and you're going to have anesthesia, it can affect the way the anesthesia affects you. It can affect the blood thinners that you're on. It can affect other medications like antipsychotics. So if you're on something like trazodone or Zyprexa or any of these like things that are meant to, a lot of elderly people who have dementia issues, which can be on some of these antipsychotics, you would need to know that you should be limiting the amount of caffeine in their system, really cutting out chocolate, any sodas, coffee, tea, anything that has a high amount of caffeine in it. You should be limiting that if they're on an antipsychotic, because you can really push them way over the edge and they could really have big problems. Again, heart medication. If you have a problem with your heart, you don't want to burn out your motor, right? So you don't want to speed up your central nervous system and make that motor work harder against a high pressure system. You're going to burn it out, right? So you want to be careful with caffeine in that respect. And again,
we've got a short time here, Kelly, because I think we have to do the meditation on time. One more.
Yeah, last one is dairy and acidic fruit juices. These decrease the effectiveness of antibiotics. So some people will think, oh, I'm taking an antibiotic. Let me take some milk and get some calcium moving in my system. Don't do that. Don't mix those two, because it actually reverses the effect of the antibiotic. And the same thing with the fruit juice. So you think, again, I'm sick, I'm going to take something with a lot of like drink fruit juice, right? Like maybe grapefruit juice or something, or grape juice, because you want to drink it, or cranberry juice. It decreases the effectiveness of the antibiotic. And the only other thing I need to say is, if you are taking antibiotics and you're going to take a probiotic, take them apart from each other. Don't stop taking the probiotic, because you need that to reseed your gut, but you don't want it to be in your system at the same time as the antibiotic. So if you take your antibiotic at 7 o'clock in the morning, take your probiotic at like noon, and then take your second dose of your antibiotic at dinner time with that meal.
Exactly.
So.
Exactly. Wow, that's just been, I mean, obviously we could go on for 2 hours, Kelly, but you're such a bundle of information. But this is why she put it all in a PowerPoint. And that's a lot of effort to do all that research, but she did it because we knew that we were going to be running late and that you would have questions. So she's going to do the meditation. So quickly, if we have some questions, give me some quick.
Yeah, let's do questions before we do the meditation, in case anybody needs to bail out.
Yeah, we have to, because then I have to bail out. Yeah. So go ahead. Nancy, go ahead quickly.
You're muted, honey.
Sorry. I've been to several different acupuncturists and every single one says, do not eat bananas. And I never understood that. Can you?
Or why?
Oh,
Now you know why.
yeah.
And,
Good.
and
So
you can have
now you
different
know why.
reasons, right? And that's a huge pet peeve of mine when somebody tells you not to do something or to do something and they don't give you the rationale behind it. You should always ask,
Mhm.
but why? And if the reason that they give you doesn't quite sound right, do some research on your own because sometimes they're misinformed and they don't know what the heck they're talking about.
Okay.
That's right. Okay.
Um,
Thank you,
and,
Nancy.
just
Any
real
other
quick-
questions or Oh,
Real quick, is it red licorice and black licorice?
Black licorice more so than red licorice.
then red, but it's both.
It can
Yeah,
affect
but
the
black
red
is worse. Yes.
more so the black.
Okay. We should have a
Yeah,
Q&A,
yeah.
you guys, sometime on this because there's so many questions.
Oh,
I
yeah,
know, and
well,
we can do that. Kelly would be happy to do that, but you see why she did a PowerPoint, because we thought there's no way we're going to get this done in an hour, and we really have to start the meditation pretty much on time because there's people that'll join us for that. Kelly, again, thank you. Thank you, all of you. Did you all get a lot from that? Did you get a lot of pearls of wisdom, of things that maybe you didn't know or that you never paid attention to because nobody had brought it to your attention? So thank you so much for all of this, for the great support, for being a great QHS family. And I'm so proud to be part of this family. And Kelly, I think we need to start the meditation. I'm going to sign off because I have other things that I have to do. And I do meditations Mondays and Fridays with our wonderful other QHS admin with, I'm going blank. It's okay, with Steph. On Mondays and Fridays at 5 a.m. for any of you that are interested, Central Time if you haven't joined us. Okay, God
With
bless.
Steph.
You go ahead and go on, and I'll cut off in a minute.
You do it with Steph.
yeah, she does.
With Steph,
If
yeah,
anybody has any
at 5
questions
a.m.
at the end of the meditation, I'm willing to stay on for a little while afterwards. If you have any questions or you think of any during the meditation, I can answer some questions then, but I know Dr. Gloria's got to go and, some other people want to be on time with the meditation. So if anybody wants to hang
The
around
meditation.
afterwards,
So
I'll be here.
perfect.
Okay?
Thank you, Kelly. Appreciate it. God bless. Thank you all for joining us. And I will talk to you on Monday on the cooking class.
Bye.
Go ahead.
Yeah,
Bye-bye.
just gotta.
Yeah, I want to wait until you get it going before I leave.
I really need to close some stuff on my screen.
Technology is great, but it's
No, I just have
constantly
too,
changing and we
I'm
never
working
know.
on too much at the same time. Where is it? Oh, here it is. Okay.
Got it?
Yep.
Welcome to today's Miracle Moment Meditation, brought to you by QHS and Key. Before we begin, let's take a minute to understand the power of our collective connection using the QHS technologies. When we gather, we exponentially magnify the quantum twine wave effect, delivering twine waves to each device and each one of us all over the world, including all members, even those without devices, the people you intend to support, and the earth itself. The Miracle Moment meditations increase and expand the quantum twine wave effect for every live
CEO and President David
with
Pecker
each
testified about the non-prosecution of
TWHHS connection. Every system added to the network increases the powerful, profound conscious quantum twine wave through each and every participating member. This is magnificent, coordinated, and collaborated communication with every device present in nano-fast times. As more QTWHHS and QT waves join the live Zoom calls, the effect is amplified even more. Today, we will be guiding you through a meditation. It's important to note, this meditation will last about 20 minutes. We encourage you to remain present and aware throughout the session.
If you experience visions or emotions, that's normal. Allow yourself to feel and acknowledge them and stay present. The meditation has several parts, each designed to guide you toward a deeper state of relaxation and connection with your inner divine essence. The first part focuses on inducing deep relaxation, allowing you to enter a state where your mind and body are receptive to transformation. The second part involves connecting with the quantum twine waves, Christ energies, and the God spark within you. This connection facilitates a profound alignment with the universal energies of love, healing, and wholeness. In the third part of the meditation, we expand upon your wellness, allowing you to fully experience and remember your innate wholeness and vitality. In the fourth part, we enter into a moment of serene silence. This silence provides an opportunity for quiet reflection and connection. This quiet reflection allows you to focus on your thoughts, feelings, or insights arise within you. We also encourage you to strengthen your bond with the quantum twine waves through the silence, tuning in to their gentle presence and allowing their healing energies to flow freely within you. Finally, we conclude the meditation, bringing our practice to a gentle close, ensuring you feel grounded, centered, and rejuvenated. Remember, the quantum twine wave is scanning each participant head to toe, and then sending healing quantum twine waves as needed, wherever needed, as requested. In a moment, we will ask you to mute your microphones and speak out loud how you would like the quantum twine waves to assist you, whether it's supporting a specific part of your body or helping someone you care about. Express your intention clearly. Once you've stated your intention, take your QT Wave device and place it on the part of your body where you want to focus attention and manifest change. If you don't have a device, you can place your hand wherever you would like to focus your attention. If you intend to support someone else, you can place your device or hand on the area of your own body where they need support. Remember, when you heal it in yourself, you heal it in others. Throughout this meditation, feel free to move the device or your hands to other areas as needed. If you have an HHS, please turn it to 20 now. At the end of the session, remember that the effects will continue to work, so if you feel the need to rest, take time to do so. Thank you for healing this beautiful world, starting with you. Let's begin by muting our microphones and stating our intentions out loud. Begin by allowing yourself to settle into your current position, feeling the natural comfort of your own presence. Now gently close your eyes and turn your attention inward. Notice the natural rhythm of your breath as it flows in and out. Take a full, deep breath. Feel this breath filling every part of your body, nurturing and soothing you from within. As you exhale, allow yourself to let go of tension and discomfort. Recognize that these sensations are not you. They are transient, merely passing through. With this realization, watch as they dissolve into nothingness, leaving no trace behind. You are boundless, free from these sensations and their definitions. With each breath, feel them dissipate as you become more present, more peaceful, and profoundly centered in your true essence. Now let's deepen your experience with a breathing exercise that will enrich your meditation, creating a beautiful synergy between your inner and outer worlds. Focus on the soft sound of your breath at the back of your nose, reminiscent of the gentle whispers of ocean waves. The
sound of your breath, like the ocean waves, anchor you to the present, connecting the vastness of the outer world with the depths of your inner being, automatically establishing harmony and coherence between your body, mind, brain, heart, and all of your energetic and spiritual systems. There's nothing else to do but be in this moment, deeply relaxed, fully supported, and profoundly at peace. Now bring your attention to your body. Identify the part of your body that feels the most relaxed at this moment. It could be as small as the tip of a finger or as large as your entire back. Focus your attention on this area. Observe how this relaxation feels, how deep, how serene it is, and imagine this feeling beginning to spread. Like watercolor on wet paper, allow this sense of relaxation to expand, moving gently to neighboring areas in your body. With each breath, this soothing sensation grows, filling you up. Breathe deeply, rhythmically, and with full breaths. Imagine the relaxation spreading further and further. Notice that it's no longer just a part of you that's relaxed. Your entire being feels embraced by this calming energy. As you continue to breathe deeply, envision waves of relaxation cascading across your body. Each wave washes over you, bringing deeper calm and more profound peace. These waves are rhythmic, aligned with your breath, sweeping through you, around you, beneath you, and even beyond you. Feel yourself being carried by these waves of relaxation, deeper and deeper into a state of complete serenity. Here, in this space, you are free to explore the depths of your inner world and to dive into the vast ocean of you. Now, let's tune in to the quantum twine waves. Take a deep, full breath, allowing yourself to fully immerse in the presence of the quantum twine waves surrounding you. Feel these waves embracing you, infusing you, and offering their gentle support. As you inhale deeply, visualize the quantum twine waves penetrating your body from the crown of your head to your toes. Sense the waves flowing through you, fostering a profound connection and resonance with your perfect wholeness. With each exhale, release any tension or resistance, allowing the quantum twine waves to permeate every aspect of your being. Notice the sensations as these waves interact with your cells, filling them with radiant light and revitalizing energy. Experience the warmth and vitality of this divine presence as it spreads throughout your entire being. Acknowledge the presence of Christ consciousness, the sacred energy that embodies unconditional love, compassion, and healing within these waves. Feel this divine energy permeating every aspect of your being, illuminating your path and guiding you toward wholeness.
As you breathe in, envision your cells awakening to the healing energy of the quantum twine waves and Christ consciousness. Feel a harmonious alignment spreading throughout your body as every cell vibrates in tune with waves of wholeness and unconditional love. Continue to breathe deeply. Surrender to the process of integration. Trust the quantum twine waves and Christ consciousness. Intuitively know where they are needed, guiding you toward a state of wholeness and well-being. Witness yourself as you bask in the deep sense of peace and relaxation that accompanies this surrender to divine energy. Now shift your awareness inward to the God spark residing within you. This sacred essence serves as your eternal connection to the source of creation, reminding you of your inherent divinity and sacredness. Feel the God spark igniting within you, filling you with a profound sense of purpose and empowerment. Witness as it radiates throughout your entire being, illuminating every cell with its divine light. Feel the quantum twine waves harmonizing with your God spark and the Christ energy, amplifying their power and potency. With each breath, these divine energies mingle and merge within you, creating a symphony of love and light that resonates throughout your entire being. As you continue to breathe and visualize, surrender to the profound transformation unfolding within you. Trust in the wisdom and guidance of these divine energies, knowing they are guiding you toward a deeper connection with your sacred self. Let this integration fill you with peace, strength, and healing as we transition into our meditation. Guided by the radiant light of the Christ energy, the unwavering presence of your God spark, and the powerful embrace of the quantum twine waves. Now nestle in, relax, and enjoy your miracle moment. Welcome to your miracle moment, designed to tap into the wellspring of wellness that resides within you. This journey begins with the understanding that the path to the collective healing starts at the core of our individual being. As we nurture and restore our own wellness and wholeness, we create ripples that extend beyond ourselves. In cultivating self-love, we find that love extends outward naturally. By healing ourselves, we lay the foundation to contribute to the healing of others. Every act of self-care is a stepping stone toward a healthier humanity, where healing ourselves becomes the catalyst for healing the world around us. Let's begin this process of transformation and embrace the wholeness that is our true nature. To begin, focus your attention inwardly and scan your body gently with your mind's eye. Notice how different areas of your body feel. As you continue this gentle observation, search for a spot within you where you feel a sense of wellness, wholeness, or joy. It might be a warm feeling in your heart, a lightness in your chest, or a calm space in your mind. Should you feel that a space of wellness isn't immediately apparent within your body, allow yourself to gently expand your search. It might reveal itself in a cherished memory, a hopeful vision of the future, or within the quiet depths of your spirit or soul. Trust that your wellness exists within you, in many forms and places, waiting for your recognition. Once you have found this spot of wellness, wholeness, or joy, focus your attention on it. Observe its qualities, how it feels, the sensations that come with it, the sense of completeness it brings. Breathe into this space, and with each breath, envision the sensations of wellness intensifying and becoming more vibrant. Whether it manifests as warmth, a sense of completeness, or an inner glow, feel it as it amplifies within you. Now, with intention, begin to allow this sensation of wellness to expand, like the warmth of the sun spreading at dawn. Let it gracefully move through your body. With each breath, it grows, filling you from head to toe, reaching into every cell, every space within you. Visualize this wellness, wholeness, and joy moving beyond the physical. See it extending into your energetic systems, illuminating them with its wholesome light. It brings balance to your emotions, clarity to your thoughts, and a deep sense of peace to your spirit. As you continue to breathe, a sense of complete wellness encompasses your entire being. You are in harmony with yourself, body, mind, and soul. In this space, you understand wellness, wholeness, and joy are at the heart of your natural state, a core part of who you are. Feeling this wholeness as a steady, unwavering presence within you. It's always there, always accessible. Anytime you wish to reconnect with this feeling, simply turn your focus inward. Now let's embrace a quiet moment together for about 5 minutes. This pause and guidance invites you to personally engage with the quantum twine waves, deepening your connection and enhancing your experience to its fullest potential. When you feel ready, gently bring your awareness back to the present moment. Take a few deep breaths, and when you open your eyes, carry this sense of wellness and wholeness with you, letting it infuse every moment of your day. As we conclude this meditation, step forward with confidence, knowing that the quantum twine waves continue to flow within you. Their positive influences remain active, extending far beyond our shared time in this space. Take this step and every step hereafter with the knowledge that you are blessed.
How does everybody feel? Does anybody want to share? Come on, don't make me call on you. Thank you, Nancy. Go ahead. You're muted, by the way.
It was wonderful. I know I put the comment in the chat that it was really low, but I went and put my hearing aids on, and I'm so used to participating that I just floated off. And
good.
yeah, I just wanted to let you know that.
Oh, thank you. Thank you.
Thank you.
Anybody else? Or did anybody have any questions related to the topic from earlier? Yeah, go ahead.
I actually do. You're right on topic with me because I'm prime. I was on statins for probably 20 years and I quit about 10 months ago. And I just was reading while you were doing that on some of my medication and my thyroid. I never realized that grapefruit affected it. So, but I wanted to ask you, my recent blood test, my red blood count was a little high. And I'm just wondering because I had carotid artery surgery, a vascular surgeon, and he kept me on low dose aspirin only because of, the blockage that I'd had. And I'm open now, wide open. But could that cause your red blood count to go up with the being on aspirin? And I'm on blood pressure.
No, I wouldn't correlate the two. And here's why. Your red blood cells are generated by or I should say the creation of your red blood cells is stimulated by a hormone called erythropoietin, or EPO for short. And that actually is made in your kidneys. And then that hormone generates another hormone that goes to your stem cells and your bone marrow and actually creates new blood cells. Just being on a low dose aspirin, you would actually expect your blood count to go low if you were bleeding. You would expect excess bleeding, so you would expect your red blood cell count to go down. So I wouldn't think that just taking aspirin would raise your red blood cell count in any way. It shouldn't affect that one way or the other.
I had surgery 6 months ago, female surgery. So, I don't know. Everything else other than
Well, I will tell you what can increase your red blood cell count in an alternate pathway is actually estrogen and progesterone can change your body's stimulation of the erythropoietin hormone, because when you change, erythropoietin is a hormone. So when you've lost some of your estrogen and progesterone production because of the loss of your uterus and ovaries, for example, that can actually affect the body, and you could be making too much red blood cells because maybe you're now overproducing erythropoietin in a fashion to try and overcome what you're lacking in estrogen and progesterone. So I don't know exactly what procedure you had, but that would be the logical pathway I would think would be involved. I think it would be more that than the act itself.
Yes, it was hysterectomy. So, okay. And then our devices are, producing, probably trying to change us back to a normal. So maybe that's influencing.
be balancing out, you could just be in that weird, like, I'm trying to find my homeostasis point, But
Exactly.
as long as it's okay to have high red blood cell count, as long as you don't have what they call polycythemia. Polycythemia vera is a problem because then you have so many red blood cells that what happens is they actually clump in your blood because they're so thick they can't move through. So then what they'll do is, rather than necessarily give you a medication, what they oftentimes do, and athletes do this, especially if it's called I forget the exact name for it, but they call it EPOing in some cases, where they know that they're going from, say, a low altitude place that they live to participate in an athletic activity in a high altitude area. People who live in a high altitude area have a higher percentage and higher number of red blood cells so that they can carry oxygen better to their tissues. So if you ever gone to like Colorado and you don't live in Colorado and you go up into the mountains, you can't breathe, you're because you don't have the right number of red blood cells. So your kidneys and your system will kick up the production. Well, what they'll do is if they know they're going to go to a place like that to participate, to compete, they'll draw off a couple pints of blood, right? So that's taking red blood cells out of their system. They'll freeze it. And then when they get to their donation, to their location, or a couple days before they go there, they have a transfusion transfused back into their system. So they have this huge number of red blood cells in their system that's circulating, so that when they compete, they have an unfair advantage over somebody else who doesn't have that natural adaptation.
Wow.
So if you have too many red blood cells, they might say, well, instead of giving you a medication, let's just take some of the blood out. And the other way that they can thin it out is give you excess fluid. So fill your body with IV fluid, like normal saline, to try and thin that blood out a little bit. But it is a problem. If your body's making way too many red blood cells, then that can become problematic. But generally speaking, if your normal red blood cell level is, say, 13 and it goes up to a 14 or a 15 for a short period of time, that wouldn't necessarily be problematic.
Cool. Thank you very much.
Oh, you're welcome. Go ahead, Trudy.
About the meditation. I just got my HHS, and I've got it set on 7, so I've only had it for a few days. But if I turn it up to 20 when everybody's doing the meditation, how's that going to affect my animals?
Honestly,
do you know if it's too high for them?
Mine, Trudy, I've had mine on 50, and my dog loves it. She preferentially goes in front of the HHS, where she's laying next to me right now, but I mean, it's just across the hall. But when she used to sleep with me, literally, since I got the HHS, she wants to be down on the floor right in front of the HHS instead of in the bed with me. So they love it. So I wouldn't think that it would have any negative effects on your dog at all, or your cat, whatever you have.
All right. I just wanted to know if I haven't, kind of got it up, a bit, if it was going to be too high all at once, or should I wait till I get up almost there?
Yeah, the thing that I've noticed, honestly, is that animals are so different, right? Because they don't have the same expectations that we have, right? The frequencies just are beneficial for. We want to rationalize and justify and quantify everything, and we use all these different things in our head to be like, oh, well, maybe I'm having a reaction, maybe it's not good enough for me, So the dogs and cats, they don't have that, they just get the beneficial parts, and they're just like, okay, I feel really good. So I wouldn't worry about it, from my experience.
Okay. All right. Thanks.
You're welcome. Anybody else, either topic, either the meditation or questions about medications, anything? No? All right. Well, I thank everybody for your participation and for listening to me yammer on for an hour. I hope you all got something out of it. I love to teach. It's one of my favorite things to do as a nurse. And
Julie, where are you going to put your PowerPoint? On the blog?
I will give it to Tracy. So I don't know where she's going to post it, but I can also ask her to post it in Telegram, so it's easy access for everybody, and pin it up at the top. We can do that too. And I'll probably do that anyway, because the members from the other rooms, there's not a whole lot of text involved, so the moderators for the other rooms may want to translate that into their languages and you know, and translate it. I tried to, there's a way that you can do it on Google Translate, but you can't do anything larger than 10 megabytes. So it wouldn't let me do it myself, but if they did like a specific slide at a time and did it that way, they could get the same information out. So in case our friend across the seas want to see anything, but okay. So yeah, I'll make sure that Tracy includes it. I'll send it to her with the notes from today.
Okay, thank you.
Thank
You're
you.
welcome. Thank you all for coming and for being part of our QHS family.
No caller.
I'll see you later on Vibe Tribe.
Thank you.
Thank you.
Bye, everybody.
Bye.